Right, so this is a case of 15 to 20% accidental burns. Okay, so this burns occurred in a factory due to some factory product burning. Okay, it was a sudden accidental burn, so patient could not avoid. So he has tried to, in trying to save himself, his hand got burned. The same thing about his the other left hand also. Okay, so what we are going to do is we are going to clean this wound well. This is a 72 hours post injury. So we are going to clean this wound well, and on the face, neck, we are going to put collagen. Okay, so most important is to scrub the wound well. This is not a very clean wound yet. We have to get it to be clean, and once the wound is clean, then the chances of infection will go down. And after cleaning the wound, we'll be putting collagen, which acts as a temporary barrier to the infection. Okay, so that is the idea of putting collagen, right? Yeah. Okay. Right, so as you can see, we have scrubbed the wound well. So all the dead skin has come out. Most of the dead skin has come out. Little bit is remaining. Face, neck part is okay. Shoulder, it's a little bit deep here. Okay. Then coming to the hand up to the forearm is okay. Hand dorsum is okay. Thumb and index finger slightly deep. Okay. Coming to the other hand. Okay, this is also okay, but the fingers, it is a little bit deep. Okay, so now we are going to put collagen on this. The idea is that we are removing the dead layer now, and then we are putting a barrier. Collagen is a barrier. It will to prevent infection. Okay, so we are keeping a removing dead skin and putting another barrier. So not only are we removing the dead skin on which the bacteria can grow, but putting the collagen will act as a barrier to prevent the bacteria from going inside. So bacteria cannot go inside, as well as even if it goes inside, it cannot grow that well because the dead layer is now removed. Okay, right, so now we'll be putting collagen. Okay, right, so as you can see, we have put the collagen. So it's a wet collagen sheet. It's covering most of the areas of the face and the neck. Okay, this ear, you can see the other side we have put here. Okay, this shoulder area, we are not putting it now because this area is deep. This is going to exudate. This exudate is going to come out, and it's going to collect underneath the collagen. So it's going to collagen will get wet and it will come out. So there's no point in putting collagen on this. Okay, this is a little bit better. We'll be putting collagen on this also, but the hand is not that good. So putting on half the area will not help. So we're not going to put, but maybe after a couple of days we'll put collagen on this. Okay, and we go to the left upper limb. Okay, same thing. This index finger is showing, the index finger, middle finger is quite deep. So we're going to wait for a couple of days and then put collagen. Right. So the idea in putting this collagen, as I told before, is to create a barrier. Collagen is a biological membrane, so it will prevent bacteria from going inside. So we have removed the source of infection, majority of the source, by removing the dead skin, and by putting a protective barrier, we will prevent infection. Okay, so this is the beginning of our treatment for such major burns. Once this is done, then the next we are going to these areas we are going to clean daily. Okay, then we are going to do then we are going to give good nutrition. Okay, we are going to give good antibiotics. We are going to keep the patient in isolation. Okay, we take care of everything, and then slowly and steadily the wound will start improving. Only when we do all of this, the wound starts improving. Okay, we'll be posting next after a couple of days. We'll take the patient again in the OT for 2 to 3 days. We'll do dressing in the ward, and then we'll take the patient to OT again, and we'll be taking further videos. Okay, right.